Hello everyone. Today we will talk about the Renate lifting procedure with you, and there are some most frequently asked questions about this procedure for us. Let's explain all these questions step by step. The first one is a really general question. What is the Renate lift procedure? The Renate lifting procedure is basically a temporal lifting procedure which we can manage the brows, sometimes just the tail, sometimes the whole brow lifting, which depends on patient's body and the facial structure. And the next step is pulling the corner of the eye like an almond shape, sometimes in a natural way, sometimes maybe overcorrected appearance. And then the other step is the mid-face area, which usually starts to go down around the age of 25 to 30 years. So we can lift the central part of the face through the Renate lifting procedure. So there are different types of techniques about the temporal lifting. That's why we need to explain this, what we are doing during the Renate lifting procedure, and why are we calling this as Renate lifting procedure other than the different types of temporal lifting surgeries. So during the Renate lifting procedure, mainly the most important thing is the lifting is not based on just the skin tightness. It's a full composite deep plane procedure. Mostly I perform this surgery over the deep spleen, sometimes the muscle, the temporal muscle surface, and mostly over the bone around the forehead area and the mid-face area. For some individuals, I may also use this mesh layer, which is a deep plane surgery too, but in a soft tissue dissection. So this is totally different than other combinations. This is not based on skin tightness only, and that's why we expect much more long-lasting results after the Renate lifting procedure. And of course, we can achieve stronger results through this procedure. So after describing the basic things about Renate lifting surgery, looks like I need to explain the incisions because this is very specific. And this is totally different than the classical facelift surgery, which we perform this surgery through the incisions here. But for the Renate lifting surgery, the incisions and the incision scars are totally hidden inside the hair and rarely sometimes inside the mask too. So the main incision for Renate lifting surgery is around on the temple area, usually around 2 to 3 centimeters behind the hairline, and the length of the incision is like mostly 3.5 centimeters, which is a really short one. And through this main incision, I can use the endoscope, the camera, and I can do all my work inside here to lift the mid-face up, to tighten the eye shape, and also to lift the brows up. And there are 2 more incisions for my patients, and they are shorter than the main incision on the temple area. They are usually located up here. They are still inside the hair and hidden here, and they are like around 1.5 to 2 centimeters. Through these extra incisions, I can manage the medial part of the brows and lift them up. And even if I don't want to lift the medial part, I use the same incisions because I will need to manage all those stitches in a crisscross organization, and this gives us stronger results. And as you can see, there is no incision on your facial skin, and there is no sign of any surgery like the hypertrophic scars or other scars that we can directly see in front of the ear. So the Renate lifting surgery gives us hidden incisions and hidden scars. And the next question is, of course, about pain. Everyone wants to see if this procedure is a painful procedure or not. So, of course, this is a surgery and this will give us some pain, but mainly this surgery is not a really painful surgery, other than, for example, a breast implant will be much more painful than Renate lifting procedure. After the Renate lifting surgery, you will not feel that much pain. You will feel mostly some headache and some pain around the temple area, because I will be performing nearly the whole surgery through this area, and there will be stitches which are holding the tissues in place over this temple muscle. That's why this will give us some pain and headache mixture in the beginning, especially in the first 3 to 7 days. But we can manage this with painkillers when you're here. And after the first week, some of the patients may describe some pain and pressure around the temple area, but this is not really common in my patients. So I can tell you the Renate lifting surgery is not a really painful surgery. But the main thing after this surgery is gonna be swelling and bruising, and most of the people are afraid of this swelling and bruising immediately after the surgery. But we know all the bruising and swelling goes away. And I will be giving you some extra medicines, and we will be talking about some other instructions to decrease this swelling and bruising. And mostly around 1 week to 10 days, the swelling goes down around 60%, and after 3 weeks it usually goes on 80% or maybe a little bit more than this. And this is like the average time for swelling and bruising, and some of the individuals may get the better shape without swelling earlier than this, but this is the average, and which we can talk about 80% of my patients. And maybe you will have the swelling mostly around the eyes, because when we work around the eyes, even just with a blepharoplasty, we can see some degree of swelling. So this is something like a rule for us. And as a result, if I need to answer this again, Renate lifting is not a really painful surgery. The pain for this is mostly lower than a breast augmentation surgery, so maybe you can predict the pain you will get this way if you had this type of a surgery before. Now let's go to the next step. This is the anesthesia type. So most of the people want to see if this surgery can be performed under local anesthesia. Technically, yes, but because this is not a really short surgery, and because this will give us really high discomfort during the surgery, I never performed this surgery under local anesthesia, and I performed this surgery just under general anesthesia. And that's why we will need to see if you are a good candidate for a general anesthesia too. So we will be doing the basic tests at least, and before coming here we are asking you some questions about your general health and the medicines that you use, the allergic reactions to anything. And up to these conditions we can do the test much more than the basic ones. And yeah, we will be checking your general health, and then we will go for the general anesthesia and the surgery, of course. So if I perform this surgery under local anesthesia, it will be really uncomfortable for you. That's the main reason. So the next question is highly related to the previous one about the anesthesia type. Because I performed this surgery just under general anesthesia, I'm using the private hospitals to perform these surgeries, and this is performed under general anesthesia with the highly experienced anesthesia team. The next question is about the combination surgeries with the Renate lifting surgeries. What kind of surgeries you can get in combination with Renate lifting surgery? Maybe you have already seen in our Instagram page about the combinations. It depends on your general health, your facial structure and everything, but I can combine this surgery with rhinoplasty surgery, mostly with the upper or lower blepharoplasty, sometimes double chin liposuction and J-plasma, and sometimes maybe just with breast augmentation. It's up to your general health. It's also up to the surgery time. And when I'm deciding the combinations of the Renate lifting surgery with the other procedures, I always tell my patients when we are planning a combination during the surgery, up to your general health under general anesthesia, I decide if I will go for the next step or not. And during the surgeries, for your safety, I will be checking all your conditions like blood pressure, heart rate, EKG continuously, and urine output for most of the patients. And up to the condition, I may also do some blood work during the surgery. And if everything is okay, and if I believe we are still safe for the next step, I can go for the next step. And the combination totally depends on your general health and condition. So we can do different combinations for the surgery, again, like rhinoplasty, blepharoplasty surgeries, double chin, lip liposuction, and J plasma surgeries. Sometimes not really extended, but breast augmentation surgeries, but not the very big and extended body contouring surgeries. Yeah, we can do combinations. When you see the results and pre and after pictures, of course you will have a question like, am I a good candidate for this type of a surgery or not? So basically, there is no age limit for this procedure. You may be 30 years old and you may not be maybe a good candidate for this surgery, or maybe you are around 50s and you can be a good candidate for this type of surgery. The main thing about this is, when we are deciding the procedure, is your facial structure. So if you don't have an excess skin on your face, and if your lower face is not that problematic, I can say you may be a good candidate for this type of a surgery, because this surgery is mostly aiming the early changes of the aging process, which are drooping of the brows, the skin excess on the upper lid. That's why I'm usually combining this surgery with the upper lid surgery. And if the corner of the eye is droopy, maybe naturally or up to the aging process. And one of the main changes on our face during the aging process is mid-face drooping. And if you have this will be the main question when we are deciding if you are a good candidate or not. So if you don't have excess skin, especially on the lower part of your face, possibly you will be a good candidate for the Renate lifting procedure. And some of our patients go back to their countries, and of course their family, their friends see their results, and they have this question. They like the procedure, they like the result, and they look for this answer, if they are a good candidate or not. So send us your pictures, and we will directly tell you if you are a good candidate or not. So mostly people who don't have the heavy changes of the aging process are good candidates for this type of a surgery. And not the Turkish people, but mostly people who are coming from different countries are asking us when they can work out, especially the heavy workout, to see the healing process better. And for a long-lasting result, we must start the heavy workout after 2 months. This is gonna be good for us. And the logic under this timing is the healing process. During the healing process, especially in the first 2 months, the healing tissues will not be that strong. And that's why if you start the heavy exercises in the early period, your muscles will try to pull everything to the central part of the face, like when you are forcing yourself and when you are trying to pull something, you will be using your mimic muscles, and they will all try to pull things to the central face. But we were lifting everything up like this, so to prevent this pull, it's better to start workout 2 months after the surgery. But maybe 4 weeks after the surgery, you can start slow running, maybe just lifting the light weight, or body weight exercises may be a good idea, but up to your healing process, we will decide it all together. And you can work out, but not in the early period. The next question is also about the social life and when to go back to work. So in the beginning, especially in the first 2 to 3 weeks, you will have a high degree of swelling, as I was explaining, and this will prevent you from socializing, so from going back to work, and you will also have tapes on your face in the first 3 weeks to support the stitches inside and also to limit the swelling. That's why with these tapes, it's not that easy to socialize or to work. That's why when you are making your schedule about this surgery and the healing process, it's better to keep at least 3 weeks after the surgery before going back to work or socialize. Sometimes, especially after 2 weeks from the surgery, I can let my patients remove the tapes and put some makeup on the face and socialize for a few hours, and then when you come back to home, you will be putting the tapes back as I described you before going back to your country. So socializing will be possible, but maybe not that comfortable in the first 3 weeks especially.